All right, today we're going to dive into a health topic that affects millions of people around the globe, diabetes. We're going to break it all down, what it is, how it works, and how it's managed, in a way that's clear and makes sense. Let's get right into it.
I want to start with a number, 438 million. Just let that sink in for a second. That's the projected number of people who will be living with diabetes worldwide by 2030. It's not just a big number, it's a staggering figure that really shows you the scale of what we're talking about here.
But a number like that, it's not just a statistic, right? It's a massive global health challenge that touches real people, real families, and entire communities. So what is diabetes really? And what does it actually take to face this challenge head-on? Well, that's exactly what we're here to figure out.
To really get a handle on diabetes, we've got to look under the hood. We need to explore what's happening inside the body. Think of it as the body's own energy crisis.
So what's the official definition? At its core, diabetes is a chronic metabolic disease. And what that really means is the body just can't manage its blood glucose, what most of us just call blood sugar, the way it's supposed to. This causes sugar to build up to high levels in the blood.
Now, you absolutely cannot talk about diabetes without talking about the main character in this story, a hormone called insulin. And probably the easiest way to understand what it does is to think of it as a key, a very, very important key.
See, your pancreas makes this hormone, insulin, and its whole job is to let the glucose, the energy you get from food, get inside your body's cells. Once that glucose is in, your cells can use it for fuel. So without that insulin key, your cells are basically locked, starving for the energy they need to work.
When everything's working right, it's like a perfectly timed dance. So let's walk through it. First, you eat something. Your body gets to work, breaking it down into glucose. Then, that glucose enters your bloodstream. Your pancreas senses this and goes, okay, time to release the insulin. Then, our key, the insulin, goes and unlocks the doors to your cells, letting all that good glucose rush in. And finally, your cells get the fuel they need, and your blood sugar goes back to normal. It's simple, it's elegant, and it's incredibly efficient.
Okay, that's the ideal scenario. But what happens when this elegant system breaks down? What happens when the key is missing, or maybe the key is there, but the lock is just broken?
And that question brings us to a really common misconception. You see, diabetes isn't just one single thing. It's actually a group of different conditions, and it's so important to know the difference between them.
So let's break this down. On one side, you've got type 1. This is an autoimmune issue where the body's own immune system mistakenly attacks and destroys the cells in the pancreas that make insulin. The result, the body can't make its own keys anymore. Then on the other side, you've got type 2, which is way more common. In this case, the body's cells become resistant to insulin, so the key is there, but it has a hard time fitting in the lock. Or the pancreas just can't make enough insulin to keep up with the body's needs. The end result for both, though, is the same: too much glucose stuck in the blood.
And we can't forget about the third major player here, gestational diabetes. Just like the name sounds, this kind shows up during pregnancy. What happens is hormones from the placenta can actually block the mother's insulin from doing its job properly. Now, the good news is it usually disappears after the baby is born, but, and this is a big but, it's a major warning sign. It significantly increases the mother's risk of getting type 2 diabetes down the road.
Okay, so we've covered the what. We know what diabetes is and the different types. But how do you actually know if you have it? Let's walk through that journey, from the first warning signs your body might be sending you, all the way to the official medical tests.
Your body usually tries to tell you when something's up. Some of the classic signs are needing to pee a lot and feeling incredibly thirsty. That's your body trying to flush out all that extra sugar. You might also notice you're losing weight without trying, especially with type 1, or that you're always hungry and tired, which makes sense, right? Your cells aren't getting any fuel. Other big ones are blurry vision and noticing that cuts or sores are taking forever to heal.
So if any of those symptoms sound familiar, a doctor's going to run a couple of key tests to get a clear picture. The two most common are a fasting blood sugar test and something called the HbA1c test. The HbA1c is really cool, actually. It gives an average of your blood sugar over the last 2 or 3 months. As you can see from the chart, the numbers clearly show where you fall: normal, pre-diabetes, which is a super important warning stage, or a full diabetes diagnosis.
Getting a diagnosis can feel like a lot. I get it. But this is where the story really pivots. This is where we shift from the problem to the solution. This is all about empowerment, about taking back control and living a healthy, full life with diabetes.
Here's the most important thing to remember.
Even though there's no cure right now, this is absolutely a manageable condition. It does not have to define you or control your life. The real game changer, the secret weapon, is effective, consistent management. That is everything.
So what does that management look like? Well, it really rests on three main pillars. First, lifestyle. We're talking about healthy eating, moving your body regularly, managing your weight, all that good stuff. Second is medical therapy, which might mean pills, or it might mean injectable medicines like insulin. And third, and you could argue this is the most important pillar of all, is health education. Truly, deeply understanding your condition and knowing how to take care of yourself every single day.
Now, the world of medication can seem super complicated, but it pretty much boils down to two basic ideas. Some treatments, like taking insulin, are all about replacing the key that the body can't make anymore. Other medicines, usually pills for type 2, are designed to help the body use its own insulin better, basically making those locks on the cells a little less stubborn and a little more receptive.
And that just brings us right back to why that third pillar, education, is so critical. I mean, listen to this quote, it says it all. Education and training have been proven to reduce short and long-term complications, lower the rate of limb amputations, and reduce medical costs. It just proves that knowledge isn't just power. In this case, knowledge is literally health.
At the end of the day, understanding your own body and your own health is always the most important first step. We've run through the biology, the different types, and the pillars of management. So I'll just leave you with this question. Based on everything we've talked about, what's one single healthy choice you can make for yourself starting right now, today?